Hey everyone, it's your boy KP here from the No Justice, No Peace report. Just dropping some more information on you about our world and what we're dealing with pandemic COVID-19 and the vaccines, right? So, as you know, whether it's in Canada or the United States, it's been pushed to say black people are more susceptible, and therefore we need to go ahead and take the vaccines, right? I'm highlighting here a couple articles. This one is from the CBC. Most at risk, first in line. Public health experts say racialized Canadians should be prioritized for vaccines. Two public health experts in Toronto say governments must prioritize vaccinating Black Canadians and other people of color against COVID-19 because the data shows they are most at risk of contracting the virus. Oh, Lord. Akwatu Kenti and Ananya Tina Banerjee, Banerjee, the radio host, the house that's failing to vaccinate those communities will not only put them at greater risk of getting COVID-19, but also increase the chance that the virus will spread more widely. Let's see here. The reason that Black people have a higher rate of positivity or higher hospitalization rates is because of social inequities and systemic racism and neighborhood vulnerabilities, said Kenty, who teaches at the University of Toronto, Lana School of Public Health, and chairs the city's Black Scientist Task Force on Vaccine Equity. I'll pick up that in an article in a second. So once again, we have here a situation where, they're pushing the vaccines on the Black community, and they're saying, okay, we're going to help you with the vaccine. You've got to take the vaccines, and then we'll fix some of the problems happening in the community. That's pretty much what they're saying. I mean, no matter what you read in these articles, you Black folks are you're more susceptible, you're gonna spread it, you're gonna this and you're gonna that, and they're not addressing other issues. They're talking about it, but they're not addressing it. It says that Ontario's Ministry of Health told CBC News that the province is already collecting some demographic information, including age and sex, from people receiving vaccinations on a voluntary basis. It is also exploring how additional data might be used to support efficient, equity, and effective vaccine rollout for communities that are at risk and disproportionately impacted by COVID-19. Oh, Lord. Anyway, let me see what this other one says here. Okay, so this is the one where John Tory, the mayor of Toronto, came up with a task force. So that article I just read mentioned this one here, where, it's called the Toronto Black Community COVID Response Plan, right? And the same doctor there, Dr. Kenty, is a part of it, right? And in this article, it says, while forming the task force, Dr. Kenty sought after professionals that speak to areas of the vaccine. The vaccine is the first of its kind, and Dr. Kenty could not confirm that anyone on the team had biotechnology experience. At least he's honest, right? On the force is a naturopathic doctor, which is good, who will address those who prefer natural remedies, but, they shut that down real quick. Nobody's interested, like ivermectin. Nobody's talking about ivermectin, okay? However, there aren't any fitness experts. Okay. Dr. Kenty explained that they're not planning to collaborate with Pfizer, Moderna, or Novavax to ensure safety and effectiveness. Let's see what else this says here. The vaccine is not proven to prevent transmission. However, Dr. Kenty claims that the vaccine will help the Black community by protecting the elderly and frontline workers, as usual. Let's see here. In terms of other things that this says here, it says here, no one knows the real impact of the COVID has had on the Black community due to medical errors, underlying health issues, inequities, and systemic racism, in addition to the unreliable PCR test. PCR test is junk. A lot of people have been saying that. If such problems are continuously ignored, the vaccine may act as a wet band-aid for the Black community that just won't stick. While it may reduce one's symptoms, long-term effects are still unknown and leaving many questions unanswered. That's exactly the point. I admire Dr. Kenty for being honest in that regard. Nobody knows. But yet, go take it, Black people. Go take it. Go take it, Black people. Black people, Black people, Black. Go take it. Black people are overrepresented in prisons. Black people can't get the jobs. Black people have to fight as hard as heck in order to get into schools or to get high positions. But as soon as a vaccine comes out, yes, you're more susceptible. Oh, a Black scientist invented it. So, it's your boy KP here, just dropping some information on you. Take care of yourself. Stay woke and stay red.